Chronic obstructive pulmonary disease, known as COPD, is progressive, irreversible damage to the lungs that often affects older adults. Although tobacco smoking is by far the most predominant risk factor of developing COPD, it can also be inherited in a minute number of cases or caused by occupational and environmental exposure to dust. COPD results in reduction of the defense system inside the lungs, causing excess mucus production, narrowing the airways, and tissue damage, inhibiting the body's ability to fight off respiratory infection. Fatigue is a contributing aspect of ineffective coughing, therefore inhibiting Patrick's body from freeing his lungs of excess mucus being produced. Patrick has an extensive history of smoking, which damaged his lungs' defense system progressively over time. Patrick's BMI puts him in the overweight category, suggesting he may have poor diet. Malnutrition contributes to the susceptibility of respiratory infections, dyspnea, and fatigue of COPD patients, and this may be reflected in the magnitude of his respiratory symptoms. Patrick's limitations for mobility can cause poor lung circulation, thus promoting poor lung hygiene and also worsening his COPD. Your heart rate is controlled by electrical signals sent across heart tissues. Tachycardia occurs when an abnormality in the heart produces rapid electrical signals that speed up the heart rate. It often indicates an underlying medical condition or issue when present for a long period of time, and any damage causing strain to the heart or damage of the cardiovascular system can increase your risk for development. The damage caused to Patrick's lung tissue during his many years of smoking results in decreased lung function. This lung stress contributes to a raised heart rate. Patrick's blood results indicate he is anemic, which is another risk factor for tachycardia, alongside his age and weight. Cardiac output is dependent on stroke volume and heart rate. Patrick has a history of left-sided heart failure and a myocardial infarction 10 years ago due to increased contractility of the muscle tissue caused by his left-sided heart failure. Patrick's heart must work harder in order to maintain cardiac output, therefore increasing his heart rate. In addition to this, the heart attack and subsequent scar tissue add to his heart's workload. The MI also causes a disruption to the heart's electrical system, altering its ability to maintain cardiac output. Patrick's history of smoking, left-sided heart failure, and MI have contributed to his increased HR. Left-sided heart failure is most often caused by high blood pressure or coronary artery disease. It occurs when the left ventricle doesn't pump efficiently, and instead of pumping blood through your body, it backs up into the lungs, resulting in shortness of breath. This is mainly caused by the decreased contractility of damaged heart tissue, relating directly to Patrick's previous myocardial infarction. Infection, anemia, hypoxia, and excess dietary salt intake are all contributing factors to left-sided heart failure. Patrick's COPD, on the other hand, was likely caused by his extensive history of tobacco smoking. The cilia projections around the cells in the respiratory epithelium serve to trap debris from inhaled air and transport it to be swallowed or expectorated. Tobacco smoke causes direct damage to this procedure, therefore irreversible damage to the airways initiates. When tobacco smoking occurs, the glandular tissues, mucosa, and submucosa are infiltrated by inflammatory cells, which lead to mucus hypersecretion, coagulation of the small airways, and a disruption in tissue repair. This results in the demand for ventilation outweighing the ability, causing dyspnea. Hypersecretion occurs as a result of reduced elastic recoil of bronchial tissue, causing the airways to prematurely occlude during exhalation and gradually deterioration in FEV. Mucus production stagnates and promotes bacterial growth, as it is not cleared out of the respiratory tract. Although left-sided heart failure is not directly related to COPD, the two conditions may influence each other. For example, low oxygen in the heart from COPD may put extra strain on your heart, worsening left-sided heart failure, while too much fluid in your lungs from heart failure may make breathing even harder if you have COPD. Both COPD and left-sided heart failure are slow-developing conditions and have similar symptoms and some similar risk factors. However, their pathophysiological causes differ. The most common cause of right-sided heart failure is the consequences produced by left-sided heart failure. Heart failure is the insufficient perfusion of the heart tissue and the consequent inability of the heart muscle to pump blood effectively to provide the body with its requirements of oxygen and blood-borne nutrients. This syndrome is the result of several types of cardiac dysfunctions, one being left-sided heart failure, which is caused by the inadequate contractile function of the left ventricle. Left-sided heart failure can be categorized as either systolic, where the pumping action is affected and the left ventricle has difficulty contracting, or diastolic, where the filling action is affected and the left ventricle is unable to relax. In regard to Patrick's condition, it is likely that he suffers from systolic heart failure as he has experienced myocardial infarction. Left ventricular systolic dysfunction is a complication of myocardial infarction. Due to the myocardial infarction, the heart has decreased contractility, and the left ventricle is unable to pump enough blood to the systemic circulation during systole. This leads to blood backing up and pooling in the ventricle and atrium, resulting in backflow into the capillaries and pulmonary veins. This results in pressure being exerted on the right ventricle, which becomes stress as it attempts to pump against greater pulmonary vascular resistance. The stress put on the right ventricle causes the tissue to stretch, leading to an enlarged right ventricle. Arrhythmia is likely to occur as a result of heightened conduction time and deviation of the heart from its normal axis. Consequently, blood pools in the right ventricle and atrium. The failure of the right side to function results in enlarged liver and spleen and peripheral edema. As Patrick already has left-sided heart failure, he has a greater risk of suffering from right-sided heart failure. Patrick already has peripheral edema in his lower legs. He has an enlarged waist circumference of 104 centimeters, possibly due to an enlarged liver and spleen. He also has an elevated pulse rate of 155 beats per minute, which is conductive of the serious arrhythmia, ventricular tachycardia. Due to these symptoms, there is a great possibility that he is already suffering from right-sided heart failure. When analysing Patrick's blood test results, it was clear that none of his measurements were within the reference and healthy range. These abnormal results could relate to Patrick's neurological function and how it could potentially be altered. Sodium is a mineral in the body that enables the balance of water levels and assists with muscle contractions and nerve impulses. Consequently, Patrick's high sodium level, also known as hyponatremia, could be related to dehydration, disorders of the adrenal glands, problems with the liver or kidneys, or excess intake of salt. Therefore, alteration to neurological function caused by high sodium levels can include muscle twitches and seizures. Potassium is also a mineral in the body, and it is vital for relaying nerve impulses and upholding proper muscle function, including that of the heart. High sodium levels are commonly related to kidney failure or chronic kidney disease because when the kidneys are damaged, they cannot get rid of the excess of the mineral. Potassium, in high doses, has the ability to create dangerous changes in heart rhythm. As Patrick suffers from heart failure, this could be deadly. Hemoglobin is a vital protein in the body that transports oxygen. Therefore, low levels of hemoglobin can negatively affect neurological function. Patrick could experience fatigue and shortness of breath from his low hemoglobin count. However, if the drop in hemoglobin is sudden, Patrick could experience an acute ischemic attack due to the brain not receiving enough oxygen. Low-density lipoprotein, or LDL, is a carrier of cholesterol through the body. Having a high LDL means Patrick has a higher risk of having a heart attack or stroke. When there is excess LDL in the bloodstream, it attaches itself to the walls of the cardiovascular system and can potentially cause blockages to the flow of blood. High-density lipoprotein, or HDL, removes excess LDL from the bloodstream, reducing the risk of heart attacks and strokes. However, since Patrick has low HDL levels, there is not enough of the lipoprotein to counteract the LDL, leaving him at an even higher risk. Patrick's high triglycerides could be a consequence of his low HDL levels, as high triglyceride levels are usually a sign of metabolic syndrome. This syndrome is a combination of high blood sugar, low HDL levels, high blood pressure, and high triglycerides. These factors could all affect Patrick's neurological function, as it makes him more prone to heart disease and certain types of strokes. Glucose is a sugar in the body that is used as energy. However, in excess amounts, it can be very dangerous. Insulin is the hormone that removes glucose from the body and transports it to the cells and tissues for it to be stored or used as energy. However, when there is too much glucose, the body can either not produce enough insulin or the cells may not respond to the insulin. This excess glucose not only relates to diabetes, but Patrick could also suffer from memory and cognitive deficiencies. An additional blood test that is likely to be abnormal for Patrick is natriuretic peptides, specifically BNB and proBNP. BNB and pro-BNB assist in the body's recovery and response to heart failure by relieving pressure in the lungs and heightening the flow of urine. Patrick is likely to have elevated levels of both these peptides in his blood due to his heart failure. These tests are used to not only diagnose but also determine the changes in the degree of cognitive heart failure. The levels rapidly rise and fall with the severity of the heart failure.